This is a video demonstration of how to measure shoulder external rotation using a goniometer by David Belisario, Betsy Webb, and Kat Hartman. We will start with the biomechanical aspects of shoulder external rotation. There are three muscles that externally rotate the shoulder actively. The first is the posterior deltoid, which originates at the spine of the scapula and inserts on the deltoid tuberosity of the humerus. The second is the infraspinatus, which is the principal external rotator. It originates at the scapular infraspinous fossa and inserts onto the greater tubercle of the humerus. And the third muscle is the teres minor, which originates at the lateral border of the scapula and inserts onto the greater tubercle of the humerus. External rotation can be limited by tight internal rotator muscles. These include pectoralis major, subscapularis, latissimus dorsi, teres major, and also other soft tissue structures, such as the glenohumeral joint capsule. A patient may present with tight internal rotators, and they present looking like this.
Indications for goniometric measurement for external rotation. So why exactly are we going to do this test? Well, if your patient comes in with shoulder joint pain, or if they have restricted movement, especially in the external rotation direction, you're going to want to take that measurement. You also want to note that you want to stop the measurement if it's too painful for the patient. Contraindications. So again, if it's too painful for the patient, you want to stop that measurement and probably eyeball it. Also, if the patient can't lie in the prone position, if they are pregnant or have any abdominal issues, you want to perhaps take the measurement with the patient lying in supine. Norkin and White provide several references in Chapter 4 for psychometric data regarding the shoulder complex. Boone et al. Tested the reliability of several shoulder measurements, including lateral rotation, and it was found to be more reliable than other motions tested. Inter-tester and intra-tester reliability were almost equally high in lateral rotation, R equals 0.96 and 0.97. Another study done by Riddle, Rothstein, and Lamb concluded that passive range of motion measurements for most shoulder motions can be reliable if taken by the same physical therapist, regardless of which goni used or what position the patient is in. However, several measurements, including lateral rotation, can produce reliable results even if assessed by different physical therapists. The ICC values for lateral rotation for both intra-tester and inter-tester reliability range from 0.84 to 0.90. So whether it's Dave, Betsy, or Kat, we can all take the measurements reliably. And now we're going to show step-by-step directions on goniometric measurements for external rotation. Step 1, expose the landmark. Step 2, patient lies prone. Have the patient abduct to 90 degrees with the elbow flexed 90 degrees. Request the patient to demo active range of motion. Put the patient through passive range of motion, making sure that they can zero. You want to line up the goni with the olecranon process, the stationary arm perpendicular to the floor, and the movable arm with the ulnar styloid process. Measure active range of motion. And then measure passive range of motion. You want to document accordingly and expected outcomes, or what is normal for this joint. Your shoulder range of motion should be 90 degrees, and glenohumeral range of motion should be 90 degrees as well.
Next, we will demonstrate measuring shoulder external rotation with proper patient interaction in the clinical setting. Begin the session by introducing yourself to the patient and washing hands.
Hi Kat, my name is Betsy Webb and I'm going to be your therapist today.
Nice to meet you.
Now explain the test to the patient using patient-friendly language.
So today I want to measure external rotation of your shoulder. So that's the motion when you go from inside out towards the walls.
Okay.
So if you can, I'm going to ask you to lay face down on the table.
Okay.
Place the patient in prone position, shoulder abducted to 90 degrees, with elbow flexed to 90 degrees. Position a towel under the distal humerus to maintain level arm, and turn their head to the opposite side.
I'm going to ask you to keep your head facing that wall. You can bring that arm down to your side. I'm going to keep this arm up so we're making almost an uppercase L. I'm just going to place the towel here to make sure that your arm is level before we start the exam. Can you move just slightly over so that your elbows creases? Yeah, perfect.
The therapist should position themselves on the side of the extremity being examined. The therapist should first request the patient to take themselves through the active range of motion, then follow by guiding the patient through their passive range. Therapist should make sure patient can pass through 0 degrees.
Kat, I'm going to ask you to bring the top of your hand up towards the ceiling. Good, and go back down. Now I'm going to do the same thing, so just relax.
If active range of motion is equal to passive range of motion, the therapist should continue conducting experiment in the gravity-resisted position. The therapist should make sure to line the goniometer up with the landmarks and place it at eye level.
I'm going to line this measuring tool up with your arm, okay?
The stable arm should be lined up perpendicular to the floor. The axis of rotation should be lined up with the olecranon process, and the movable arm should be lined up with the ulnar styloid process. After observing the patient's range of motion, the therapist can estimate the measurement by placing the movable arm at the expected range while making adjustments as the patient reaches end range. While conducting the exam, the therapist should be stabilizing at the distal humerus to prevent the patient from compensating by lifting the arm or shoulder off the table. If specifically measuring glenohumeral external rotation, stabilize at the scapula. The therapist should also be aware of other possible compensations, such as excess lumbar extension and posterior tilting of the shoulder once the patient has passed end range. The therapist should measure active range of motion, followed by passive range of motion.
Okay, Kat, I'm going to ask you one more time to lift the top of your hand up to the ceiling for me. Is that as high as you can go?
Yep.
Okay, now come back down. Relax. Now I'm going to bring your hand back up. Okay, relax.
Documentation through normal range will be written as 0 to 90 degrees. If active range of motion does not equal passive range of motion, patient should be moved into supine position in order to test the range of motion in a gravity-eliminated position.